Good afternoon, everyone. Today we are here to meet Dr. Abdul Aziz, one of the best cardiologists in Bahrain at Bahrain Specialist Hospital, to understand and discuss about the most discussed problem, heart attack. Heart attack, hypertension, blood pressure, bad cholesterol. We hear all these things, but we don't know exactly how to tackle it and what exactly precautions to be taken to avoid this. Today we are here to discuss this in detail with doctor and take his guidance. Doctor, first of all, thank you for sparing your valuable time from your busy schedule. As earlier I have discussed, we would like to know about the heart attack, but you can explain, Doctor, about your experience, about your journey also.
Okay. So I'm Dr. Abdul Aziz. I'm working as an interventional cardiologist at Bahrain Specialist Hospital. So basically, what an interventional cardiologist does is, when the patient has a heart attack, there is a blockage, and we are the ones who clear the blockages. So what exactly is a heart attack? So see, the heart basically is a pump. It needs to pump blood, but
Okay.
also it requires arteries to supply blood to its own muscle.
Okay.
And when one of these arteries that supply the heart muscle, they get blocked by means of cholesterol plaque or by means of a clot, if there's a sudden cut off, then that part of the heart does not receive blood supply.
Okay.
So that becomes a heart attack. So the patient can have chest pain, the patient can have breathing difficulty, patient may feel dizzy, he may be profusely sweating. So these are the usual symptoms. And the problem is the patient needs to realize these things. A lot of times patients
Yes.
don't understand the severity of the symptoms, the intensity of the symptoms. A lot of us think the heart attack means the patient should have chest pain in the center and then collapse. But most of the heart attacks don't happen like that. It may be a vague little chest pain here, a little bit of dizziness, a little bit of shortness of breath. These may be the subtle signs of a heart attack. So when there's a heart attack, so there is basically a clot that has blocked the artery. So the heart is not receiving blood supply. If we do not restore this blood supply on time, then what is going to happen is this heart muscle is going to start dying slowly.
Okay.
So that is why it is really, really important that we do this on time. So what we say a golden hour. So the first hour after the onset of symptoms is called as a golden hour. Meaning, if the patient comes to us within this 1 hour, the chances that the patient can recover from the heart attack and recover with a good heart function are very high. So very, very important that there is a clot that needs to be treated and as soon as possible. Ideal time is within 60 minutes, but the sooner the patient comes to us, the better we are able to help the patient.
So you mean to say as soon as patient gets these symptoms, he should come to the hospital within 1 hour, within the first
Yes.
initial symptom time.
Yeah.
But I would like to know, doctor, first of all, that what is the age? Because nowadays we see that even youngsters are getting. Earlier there was a some concept that okay, after 40 or after 50 you will and
Mhm.
somebody will get the heart attack. But nowadays we see some youngsters are also getting.
Yes.
So how do you advise, or what do you exactly tell? What is the exact age when we should
Mhm.
start getting this alarming call?
Yes. So that's a very good question, and we have seen this frequently in our practice. Out of the so many angiographies and angioplasties that we do at our center, roughly about 50 to 60% are in the age group of 40, 45. So it's
Okay,
quite young. I mean, earlier, 20 years back, we would see patients who were 60 plus, 65 plus having heart
exactly.
attacks. So nowadays, we're seeing younger and younger
Yeah.
patients. There are multiple causes for this. One, there is a widespread prevalence of risk factors like diabetes,
Okay.
obesity,
Okay.
hypertension, high blood pressure, high cholesterol levels, and these are sometimes not even diagnosed because the patients have never checked these things. So these are sometimes undiagnosed. Then, secondly, there is a lack of physical activity
Hmm.
on the part of many general community. Hardly we see most of us are sitting at computers
Yes,
doing desk
correct.
jobs, typing away
Yes.
8 hours, 10 hours at
Yeah.
the office, and we don't
Yeah.
get to do any physical activity. So these are some of the common risk factors, and of course, there is a very stressful lifestyle that we're living now.
Okay.
So I would say people are probably aging faster.
Okay.
A person who's 40 years now,
Yeah.
he's almost like a 50-year-old man because
Man.
he's got so many risk factors already, so many stressful factors. Apart from all this, in this part of the world, there is a huge prevalence of smoking.
Okay.
If you go by the statistics, roughly around 40 to 50% of the people have smoked here at least
Okay.
for some time in their lives. So this becomes a major trigger factor when it comes to younger patients coming with heart
Heart
attacks.
attacks. Okay. Um, Doctor, what is the normal routine life? What is the lifestyle they should maintain to avoid this basically?
Yeah. So prevention of heart attack, yes, there is a lot of things that is there. Starts with lifestyle changes. So first of all, you need to get physically active.
Okay.
So the recommendation is at least about 30 to 45 minutes every day for 5 days a week.
Okay.
Any sort of physical activity. You can walk, you can jog, you can swim, you can play a sport, get involved in a sport, play
Correct.
tennis, play racket, whatever you can. So, get involved. So at least 30 minutes, 5 days a week. This is the minimum.
Minimum.
You can go
Okay.
more than this
Hmm.
as you progress. Second is, of course, diet. So diet you need to control less carbs, less fats, and more of fresh fruits and vegetables in your diet.
Correct.
Less of processed foods, less
Processed
of
food.
red meat.
Okay.
These are the things you need to change. And of course, good sleep is also very important. You need to get at least 6 to 8 hours of sleep. We see people who are working 12 hours, 14 hours a day, and they don't get enough time to
Enough.
relax, enough
Yeah.
time to sleep. So that can also trigger these things.
And once, suppose somebody gets the symptoms which you earlier mentioned, that is the main focus area of this discussion today as well. That if somebody gets the symptoms at home or in the car or in the office when he's alone, by the time he reaches to the hospital, there is a vast, time span which has been wasted.
Right,
So, what precautionary measure he has to do, or anybody has to do,
right.
at that particular time?
So supposing you feel any of these symptoms that I mentioned: chest pain, shortness of breath, dizziness, sweating, palpitations, or any one of your close family or friends have these symptoms. So first and foremost, it's really important to get to the hospital as soon as possible. Right. So you can call the ambulance services, emergency services. Call them. Try to get to the hospital as soon as possible. If an ambulance is not available, okay, you can have somebody drive you to the hospital, but
Okay.
don't drive yourself.
Self.
If you're
Okay.
having chest pain, you might feel dizzy at some point. You might even faint, so that you become a risk factor for yourself and for the people on the road.
Road.
Yeah, so you can have somebody else drive if an ambulance is not available. So some basic things that you can do. First thing, if you are with someone who's having chest pain, first reassure the patient. Okay,
Okay.
I'm here for you. I'm going to take care of you. We will take you to the hospital. That goes a long way.
Okay.
All right. Second thing, don't let the patient do anything strenuous,
Hmm.
like walking for a long distance, climbing up or
Okay.
downstairs.
Okay.
If you have a wheelchair, let's say something's happening at the office, you have a wheelchair at the office, use a wheelchair.
Wheelchair. Okay.
Minimum amounts of steps to be taken. Third, stay with the patient, stay calm,
Hmm.
okay? Call the emergency services and keep a continuous watch on the patient,
Hmm.
all right? And see, what happens is the most a fearful thing that can happen is what we call as a cardiac arrest. The patient who's got chest pain or probable heart attack suddenly can become unconscious.
Okay.
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 Now this is what we call as a cardiac arrest. What is a
Hmm.
cardiac arrest? So the heart needs to keep pumping,
Hmm.
and suddenly if the heart stops pumping
Hmm.
or it starts just quivering like this without a good forceful contraction, so
Hmm.
there is no effective flow from the heart to the brain.
Hmm. Brain.
The patient may lose consciousness, he
Okay.
might faint. So when this happens, you need to be able to act fast.
Hmm.
So for that, supposing you are in this office, you see somebody suddenly lying down on the floor, has become unconscious, you need to go check the patient. Immediately check the patient, talk to the patient. Hello,
Yeah.
hello, how are you
Yeah.
doing? You see there's
Even
no
at home or
response.
in the
Any at
office,
home
yeah.
office, you see
If
this.
that happens,
So
yeah.
first try to wake up the
Wake
patient.
up the patient.
There is no response.
Hmm.
All right. You see his breathing. Is he breathing or
Hmm.
not? All right. And then if you see a patient is not conscious, is not breathing, you need to start CPR immediately.
Okay.
CPR is cardiopulmonary resuscitation.
Okay.
It's a simple technique that can be learned by all of us.
Correct.
You don't have to be a doctor or a nurse to understand this. It's a simple technique. You can learn it within a couple of hours. So basically, what you need to do is make the patient lie down flat
Okay.
on the ground.
Okay.
All right, the patient is not breathing, is not conscious. You've seen that already. Then you start CPR. So you use this part of the hand.
Okay.
It's called the heel of the hand.
Okay.
Okay, put it on the lower one third of the chest.
Okay.
Okay, in the middle, the sternal bone.
Yeah.
And you start compressing.
Okay.
You start pushing.
Pushing.
You
Okay.
start pushing the
Together.
chest. So that movement should be around 100 to 120 cycles per minute.
Okay.
Okay, and then the depth should be about 2 inches.
Okay. So it has to be fast and with the
Fast,
strength.
yeah. You need to push fast. You need to push hard.
Hard.
All right. So you push. You allow the chest to recoil. Push. Allow the chest to recoil.
Okay.
And how long do you do this? You need to keep doing this until the patient becomes conscious.
Okay.
Or emergency help arrives. So while you're doing this, when you've started CPR, supposing you're alone, so what you can do is take out your phone, dial the emergency number, put it on speaker, start doing CPR. So whatever you can talk to the emergency services, you can guide them about where the location is, what has exactly happened to the patient, and they can also guide you based on your feedback. So put the patient on speaker and keep doing CPR until somebody comes to help you.
And there are some tablets also to be put in the mouth if somebody is I mean, everybody should carry that after 40 years. I mean, because they don't know and they have not done the checkup. At least that can be in their back pocket.
No, may not be in the pockets, but there can be certain medication that you can have as a first aid kit at home, at offices.
Okay.
So one of the commonest things used is aspirin. It's a simple tablet, aspirin 300 to 350 milligrams. If the patient is conscious, okay, if you have soluble aspirin, you put it in a glass of water and ask the patient to drink
the
it.
water. Yeah.
If you don't have that, you can ask the patient to simply chew the tablet.
Okay.
So when you chew the tablet disintegrates in your mouth and gets absorbed directly from the mouth. It doesn't have to go into the stomach and get absorbed. So faster absorption occurs.
Okay.
But if you don't have aspirin at home or in the office, don't go around looking for the aspirin.
Yeah.
Your priority should be to take the patient to the hospital. Once you're at the hospital will give you everything.
Definitely.
Yeah. So this is the only medicine that I would recommend to have it with in your first aid kits, so that if it's required, you can give these patients. Other medications may be given, but it depends on a lot of factors. Like there's a medication that you put under the tongue, the nitrates. But for that, there are certain contraindications. If the blood pressure is too low, if the heart rate is too low, you cannot give this tablets. So don't try to give these things.
So aspirin is like
alone,
aspirin.
and then get him to the hospital. Yeah.
Also, one more quick thing, if you can just suggest, doctor, because in Bahrain, where people, because not necessary that everybody is staying towards Jufair side or Manama side. Some people are on a different locations, little far, Sitra or Rifa or whichever areas. So, how do you suggest them where to go and contact which hospital immediately?
Right. So in Bahrain, as of now, there are only 2 centers that have the capacity to do an angiography and angioplasty as an emergency service. One is us, Bahrain Specialist Hospital at Jufair.
Okay.
The other is the Mohammed bin Khalifa Cardiac Center in Awali.
Okay.
In Awali. So if you're close to Jufair, please come to Jufair, to our hospital. Other areas, if you're in Rifa, if you're close to Awali, you can go to the hospital in Awali. But if the patient is very sick, you don't know what is going on, you can take them to the nearest hospital, and then from then you can get to the other center.
Okay.
All right. But if you're close to a hospital that it's always better that what hospitals are close to you. It's always better, which are the doctors that you can trust.
Yes.
Also, better to know which insurances you have, which is your hospital network. Because a lot of patients, they come in and they don't know whether the hospital is covered or not, whether they'll have to pay themselves or not. One of the biggest reasons people delay coming to the hospital is financial.
Okay.
They think, okay, this might cost me a lot. You think, okay, this is probably gas. It'll go away. Others will go tomorrow morning.
Yeah.
And so, if you know your financial status, if you know your insurance status, it's easier to go to the hospital. So, I think everyone should have done a little bit of homework, and they should start early. Probably in your 30s. First of all, get yourself checked. You see what the risk factors you have: diabetes, blood pressure, cholesterol, whatever. Have a doctor with you who's like a family doctor or a general doctor.
Correct.
So that we can maintain contact with them and know the hospitals in your network, so that you can prepare in advance.
Correct.
See, all these things happen suddenly. A heart attack, we call a heart attack because it happens suddenly.
Suddenly.
It doesn't give you time.
Okay.
Like say a brain stroke happens suddenly. It
Suddenly.
doesn't give you time. So you need to be prepared well in advance.
Okay.
All right. So I would suggest, you take a good quality insurance, discuss with your family members, let your spouse also be aware.
Aware,
Yeah.
exactly. At least one person in your house
I
should be
should be
aware.
aware that,
Yeah.
okay, this is
Yeah.
where I can
Hmm.
go, and this is where I can treat.
Treat. Correct. And how many times at least they should do the checkup? Normal checkup. Normal people, I mean,
Yeah.
if they want to know at least the status of their heart and their
Yeah.
condition, at least once in a year or
Once in a year.
once in
Once in a year should be checked. What you need to check? You need to check for your diabetes. If you have diabetes or not, check your cholesterol, check your blood pressure, and simple tests like maybe an ECG,
Hmm.
echocardiography, and a treadmill test. Okay,
Okay.
ECG is a simple test.
Yeah.
Everyone knows that. Echo is like an ultrasound for the heart. We see how the heart pumping is.
Right.
All right, and a stress test where we ask the patient to walk on a treadmill for 10 minutes and see how the heart responds to that stress.
Okay.
So in that manner, we can pick up heart disease before it becomes a full-fledged attack.
Attack.
All
Okay.
right. So usually what happens is the cholesterol buildup in the coronary arteries takes time. It happens slowly over months or years.
Hmm.
So if you're doing an annual checkup every year you're doing a checkup, so it is possible that we might pick up disease even before the patient lands up in a heart attack.
Mm-hmm.
So that is very important. All these things should be at least once a year. When do we start this?
Hmm.
The younger
Correct.
people having attacks, I would say start as early as 30.
Okay. Okay.
Here for the last 5 years or so now, and we have seen a lot of patients coming in with heart attacks, and a lot of them, like as you said, are very young patients. A lot of them are Indian expats or from the subcontinent. The reason for these people getting heart attacks younger at a younger age is multifold: higher prevalence of diabetes, blood pressure, smoking, lack of physical activity, and if you have a bad family history, like say
Correct.
somebody in your family, your parents or your siblings had a heart problem, it is more likely that you will also develop a heart problem.
Correct.
But you cannot change the family history. What you can change? The modifiable factors. You can start exercising more frequently. You can look after your diet. You can go for a checkup and keep all these numbers under control. Keep your sugar under control, keep your cholesterol under control, keep your blood pressure under control. And these things are very easy. You probably need a checkup once a year and find out what is your risk and accordingly try to modify that risk.
Absolutely, absolutely. Now, as doctor has already mentioned all the parameters and he has given the guideline, it is so useful for everyone. Whoever is thinking that they need to come here and do a preliminary checkup, please do come in Bahrain Specialist Hospital. Dr. Abdul Aziz is here. He is there to guide you. And whatever the guideline he has given is just a basic guideline. But everybody has different issues, health problems, and they may find different symptoms. So it is advisable that they come personally here and take consultation and the guidance from doctor directly. So, Doctor, thank you very much. First of all, you have given such
Thank
a
you.
wonderful inputs about this. There is always so much fear about these topics,
Yeah,
people don't want to discuss also.
yeah.
But you have given this in a small breakups in a very simple form. And I'm sure now people, instead of getting scared, they will
Yes.
definitely think about this and they'll come and they'll do their checkup and take the advice from you.
Thank you
Thank
so
you
much.
so
Thank you so
much.
much. It's been a pleasure talking to
Thank you
you,
so
and
much,
I
Doctor.
hope this reaches out to the maximum audience
Definitely.
and they
Thank you
can
so
benefit
much.
from this.
Thank you so much.
Thank you.
Yeah.